Hey everyone. So, a few years back, you might recall that we had Dr. Maddie on, who was my perinatal chiropractor. And I'm so happy to be joined by her twin sister, Dr. Johanna Hartley, who is based in St. Pete. Hello, welcome. And Dr. Johanna actually has her own podcast, Born for This Stories, with her husband, Peter, and I was on there. And I think what's really interesting about your story is you and your husband came from this very holistic, chiropractic minded background. And you were thrusted into this situation with the home birth of it's your second son, right?
Yep, correct.
Yes, where you had some very difficult decisions to make that really challenged your holistic outside of the hospital system values. So let's hear more about that. Can you walk us through? Let's start off with, you can tell us a little bit about your holistic background, like
Mhm.
how you ended up that way. And then what exactly happened at the home birth? What was that turning point for you?
Sure. Yeah. So Pete and I came from different backgrounds. Like I grew up in the Northeast. I grew up in Delaware, and many of years, like at the beginning of our life, like we did not live like in a holistic type of family. We were just like your mainstream. We just like did all the regular mainstream things. And early on, I had shared this when we had interviewed you. My mindset, my perspective had started to shift and change because unfortunately, when I was 10, my sister and I, we also had a younger brother and he passed
Mm,
away in his sleep when he was 7. So
so
that,
sad.
if that doesn't shake you to the core, I don't know what
Mm,
will. And I say that meaning like the backstory on that is that he had been sick for several weeks, like off and on. My mom had taken him to the pediatrician several times. We just kept getting sent home saying, like it's fine, it's viral, just that kind of thing.
yeah.
And one night he fell asleep and he didn't wake back up.
So devastating. What was it that he had ultimately?
Well, on his death certificate, it says that he had the flu.
What?
Yes. And I can't, so like, I haven't actually, like, I can't bring myself to ask my mom like different questions, like, did you give him the flu shot and stuff like that? Because
Right.
for me too, like, I just don't want to put her in a position where she feels like at blame or anything like
Of
that.
course.
Because we were just living, your daily lives inside of the system that you were in. But like all of those thoughts went through my mind. Like, did he receive the flu shot? Like, was this like like a side effect of that? I do believe this was like the same year that like maybe the bird flu was like really rampant here. So
Yeah.
there's just like so many thoughts now that I'm older and I understand so many of these things that went through my mind. In addition, like just in addition to all of that too, like now with my children, like I'm so empowered that when they have a sickness or fever or something, just like holistic remedies that we can do to help support their body and ways to gauge and track to make sure we're on the right path that she didn't
Yes.
have. So all of really that was like the starting point in this transition into this like holistic lifestyle. And it wasn't really I don't recall it being like the same time frame for my mom, but my mom had dealt with chronic pain for so long. Like actually that
Mm.
night she was off and Baltimore was like an hour away and she had been doing massage school for the last year. And that was her night that she left to go take her final exam.
Oh my God.
Yeah, so like all of this like just like tragedy around this big moment and when she came home that's when she found my brother.
Devastating. I can't even fathom. What year was this?
I mean, it's back in the early 90s.
Okay,
I
sometime in the
wanna
night.
yeah,
Oh my
because
how old were you at the time?
10.
Right, you said 10. Oh my God. Now after that, because you mentioned, and obviously I would do the same, I would not want to ask, was the flu shot given? But after
Mhm.
that, do you recall whether you and Dr. Maddie had flu shots or anything of that nature after that incident?
So, not that I recall. I also think at that time they weren't pushing them as hard as what they do now is
Yes.
because I mean, we did like get the routine vaccines when we were kids. Like that was just like
Same.
the family that we grew up in. But I do remember like the point of like getting to college and them like saying, "Oh, you need these vaccines to go to school." I'm like, "What?" Like, but like I'm not a kid
You're like, "I'm
anymore.
healthy."
Like
And
yeah,
you're
like
like,
I'm
"I'm totally
healthy.
fully
I'm
functioning."
not a kid anymore. I had already started to question a lot of things inside of medicine because I also had asthma really bad as a child.
Yeah.
And it wasn't until I started to get adjusted when I was like in high school that that started to change and improve without medication. And I
Yes.
was stubborn, like, I didn't wanna do the my inhaler, like, like, rejected all of that stuff even though I did need it at the time because it just helped with my asthma attacks, but, once I found out that, like, oh, I was getting adjusted and I don't know why, but, like, my asthma is getting better and I can be active and I can do these things that it so when I went to college and they're like, "Well, you need these to get to go to school." I'm like, "I don't think that's true." Like, I'm not gonna put
Yeah.
that in my body, like, I'm not doing that now that I have a say and I have a choice. But I also remember this was roughly too, like, as I went to I graduated high school in 2004. So,
Right.
so it's, like, right around that time, like, where other things they were just becoming more prominent. But
Oh, yeah.
you still had more of, like, a choice, I guess, or you felt like you had more of a voice during that time.
It's so true. It's interesting how that lifted the veil for you, the fact that, like, okay, wait
Mhm.
a second, chiropractic care means I can function without my asthma medications. I actually also had childhood asthma, interestingly. I grew out of it not through chiropractic. I didn't even know what chiropractic care it was at the time when
Yeah,
I was 10, but it was around the age of 10. I somehow grew out of it, but I was on like albuterol, prednisone,
yeah,
all the inhalers,
yeah,
nebulizers, all of it. Yeah, I remember
yeah.
having to bring an inhaler to school, and I haven't touched that stuff for
Mhm.
25 years. It's
Oh,
so
yeah.
interesting.
Same, same.
Yeah.
And I think there's, like, older I get and the more I know and the more holistic time spent, I think all kinds of factors go into that, like possibly like mold exposure and
Yeah.
all these like underlining possible like stealth infections. But without knowing all that information at the time, like I do know like when I was getting adjusted, like my asthma wasn't as bad. Was better, and I didn't have to use my inhaler as much, so that's also
Yes.
the other reason that I got into chiropractic because, like I said, when I was getting adjusted as a teenager, I didn't know, like, the doctor wasn't telling me, like, "When you get adjusted, it positively influences, like, your body and it can heal and repair," but I was just like, "Whatever this is, like, I wanna help people, and I wanna make sure that they don't put their kid down or they don't lay down at night and they don't wake up."
Wow. Yeah, what a story. So fast forward, you had 2 home births, right?
No, I tried for 2 home
Oh,
births.
that's right. You okay, the
Yeah.
first one was right, home
Yeah,
birth attempt. Yeah.
but also, like, that I feel like the first one shouldn't have even went the way that it went, but it's with having all the information that you have, being in a wellness and holistic space, I still felt misled toward the end and very
Yes.
pressured into making decisions I didn't wanna do. So, with my first, I had a midwife, the goal was a home birth. Everything was all good, totally fine, and then right at, I wanna say 36 weeks, she checked me and was like, "Your baby's breech." And I'm like,
She checked you,
"Well."
not a cervical check, but you mean
No,
like a
just like a
palpation.
palpation check, and
Yeah.
she's like, "Your baby's breech." And she's like, "And he has been since at least 30 weeks. I've known this since, like, week 30." And I'm like,
But she's just now telling you.
"Well, she's just now telling me." And she's, like,
Yeah,
sounding the
interesting.
alarms. And she's like, "But you have time, like, don't worry." And I'm like, "Oh, okay." Like, I'm in full freak out mode, like, I'm a chiropractor, I've been getting adjusted, we do
Yeah.
Webster. I'm like, "Why is my baby breech?" Like, I don't understand. And she tells me I have time, and then she calls me a couple hours later, and she's like, "You're scheduled for an ECV within the next 48 hours." And I'm like, "A what?" I'm like, I don't know if I
No.
even wanna do that," and it just, like, spiraled. So, I felt very, like, pushed. She's like, "Well, you have 48 hours." So I did, like, adjusting, I did acupuncture, I did moxibustion, I mean, literally, like, anything you would do. I did all of those things, and I went to the hospital, and they actually turned me away because she scheduled it too early. Well, someone messed up, right? They
That's
don't.
nuts. The home birth midwife scheduled you to
Yeah,
usually you'd think it'd be the other way around. The
yeah,
hospital's like, "No, come on in at
yeah,
30 weeks." I've actually found this to be a thing recently where the home birth midwives are actually more spooked than the hospital doctors who have, like,
mhm,
seen it all, and they're
yeah,
more chill. It's like the pendulum has swung so far now. I also
yeah,
find it interesting that she didn't first just ask you like, "Hey, do you even want the ECV?
mhm,
Here's your
yep,
options. You can do
right,
nothing."
yep,
She could have said like, "Hey, I am not licensed to be here if your baby's
mhm,
born breech, okay? So you can do an ECV or I can help you find a midwife in your state who will attend breech. Like I know of one, Fadwa on the East Coast, for example.
mhm,
Not convenient, it is a drive, but hey, like shouldn't you know? Maybe you
yeah.
want to get an Airbnb."
Yeah, so none of this was in the conversation, like, she didn't ask any of those things, which then I felt completely like she's not on my team and she's not on my side, and so I did do that additional research. I think I contacted the midwife that you had spoke about. My son
Yeah.
was due technically, he was due, like, mid-July. So if you know anything about the home birthing world,
Mm.
everyone takes vacation in July.
Yeah. It sucks.
So I had contacted her and she was like, "I would totally take your case, but I'm not, like, able to because, like, I'm basically on vacation." And I also
Yeah.
knew at the time there was an OB up in Atlanta that would let you do a breech vaginal. And I
Yes.
was like, "Well, maybe we," and he'll take a late transfer according to, like, the information that was out there. So I'm like,
Yes.
"Maybe we'll do that." And we weighed our pros and cons, and then we did decide to actually do the ECV. And so the ECV was successful. So I was, like, very
Wow.
grateful for that, and I was also nervous because I had heard, several times, like, if it wasn't or, like, they're gonna induce you once as they turn the baby. They didn't do any of that. The ECV, they had to monitor me, I think, for, like, 2 hours, and then they sent me home. But I do believe this led to my water broke at I think I was 41 and 5,
Okay.
and nothing else happened.
Yeah.
And so same
Rough.
midwife goes, "If you don't go into labor in the next 24 hours, you either need to go to the hospital or you can take castor oil." And so I'm like, "I'm gonna take castor oil because
Of course.
I wanna have this home birth." So I take shots of castor oil per her recommendation, and I don't know, I'm sure you know,
I
I don't know
haven't
if I can
taken it,
say
but
this.
I've heard horror stories. I mean, you were probably
It bitch
shitting
slaps
like
you
crazy.
into very aggressive labor.
Yeah.
I was so sick. I was, like, vomiting nonstop, and I was
Oh my
laboring,
god.
like, back to back to back to back contractions, and I think I also had back labor without ever being, through labor before. I think that was part of what was going on, and I finally got to the point, like, at home that I felt, like, pressure, like, to push, so they put me in the tub, but, like, meanwhile, just again, my midwife is, like, sleeping on the couch, and
Stop
the
it. And how many
doula
hours were you wait, how many hours was she there for at that
I
time?
mean oh gosh. I mean, she probably was there for, like, my first labor was long. Think
Yeah.
I I think I labored at home for, like, close to 2 days before I transferred to the hospital.
Was she there for all 2 days?
She was there for majority of the time, yeah, but
Okay.
this was, like, I remember because, like, she came in, I think it my water broke, like, mid-morning. I was at Publix and, like, I had a slow leak and, like, I was in the
Yeah.
checkout line, and so it wasn't like a gush, but it was a slow leak, so she came and checked me, or I went to the birth center to be checked, and then she sent me home and she gave me the instructions, like, if you don't you either need to do castor oil or, like, you have up to 24 hours. So I did that, so then it threw me into aggressive labor when it finally set in,
Ugh.
and so this was, like, late, I feel, or probably, like, really early, early in the morning, like, mid-hour, like, really, like, probably, like, 1 or 2 AM that I'm like,
Oh,
"Okay, well, I think I need to push," like, so I'm in the tub and, like, the doula's with me. I know nothing. I've never given birth before, my husband doesn't know anything,
yeah.
and I just spent a lot of time in there, and it just, nothing was happening as it was supposed to happen. So, I do recall at one point her checking me, and I had, like, a cervical lip, and she had, like, another midwife come and was like, "Your baby's just not gonna get around, like, he's not coming down, like, this is the."
They can't just fix the cervical lip, which really should resolve with time and pressure.
Yep, so none of this was, like, obviously discussed, and then I was just done. I was so tired, I was so dehydrated, had been, of course, like, getting sick this whole entire time. I couldn't
Ugh.
eat anything, I couldn't drink anything. So I was did the drive to the big hospital in Tampa, and it was, like,
Oh
the most
god.
excruciating drive I've ever had in my whole entire life.
By the big hospital, do you mean Tampa
Tampa,
General?
yeah.
Yeah.
But honestly, besides, like, that, it was, like, mostly good when I got there. I
Yeah.
remember I was in a lot of pain. I was, like, really vocal when I birthed, and the nurse was like, "You're not gonna get an epidural, you're about to have this baby." I'm like, "I've been like this for hours, like,
Yeah.
10 centimeters, ready to go for hours, and
Yeah.
this baby's not coming out, and I'm tired, and I'm done.
Yeah. Yeah.
Give me the epidural." So
I
they
so get
did,
it.
and they were so good. They gave me the opportunity to push once I rested, and I was able to have him vaginally. So I was very
Wow,
happy
what a
in that
miracle.
regard. But what a
The
it w
journey of getting there. Like, imagine obviously, you've done this imagining, but, like, imagine if the midwife hadn't put you in that corner
Uh-huh,
with the ECV, with
uh-huh,
the, like, you need castor oil or you're
mhm.
going to be induced.
Yeah,
Your baby probably just wanted to be born shortly after 42 weeks.
yeah. Yeah, I mean, I just feel all those things, and this also was before, like, Breach Without Borders wasn't, like, as
Yeah,
big or even around, like, so I didn't have that information, and I felt like if I did, I would have felt more empowered to, try for a vaginal breech birth at home if I could find a midwife to do it. I mean,
yes,
that's what he wanted to do, you know?
yes,
So, it took a lot of, like, working that through, right? Like, mentally to get to a point of having a second, but once we decided we were gonna have a second, I'm like, "Well, I'm still gonna try for a home birth." Like, I don't think it was any reason that I couldn't do it at home, right?
absolutely.
So and when I got pregnant with Silas, I had actually spotted for a long time in the beginning. I had contacted my new midwife that I had
Yeah.
picked, and I was, like, super excited. I, like, contacted her early, and then, like, literally the day after I contacted her, I started spotting, and I'm like,
What week was this in pregnancy?
so this was right around week 5,
Wow, so
probably.
did you think like, "Okay, is it implantation?" Because that could be
Mhm.
implantation bleeding, but then you
Yeah,
wouldn't expect it to go on for weeks and weeks. Was it
right.
bright red or was it, like, dark brown in color? Do you remember?
It was more like bright red.
Wow, okay. Yeah, so fresh blood. Interesting,
Yeah.
because I spotted a little bit at week 9, so I was like, "This
Mhm.
isn't implantation bleeding.
Yeah,
Okay, what's going on?" And sometimes you hear about this, like, "Oh, it's old blood just naturally leaving."
yeah.
So did you find out ultimately what that was from, the spotting?
No, I mean,
Yeah,
to this
interesting.
day, like, not really sure. My placenta did have, like, certain areas that looked like they had maybe like a cyst of sorts or something on it, but I
Okay.
forget what she called them. So, like, once the placenta was delivered, it's like, "Oh, well, maybe it was from that,"
Mm,
you know? We're not
yeah.
really sure. And she was so sweet. Like, I had never even met her before, and she came and she, like, drew my blood, and she's like, "Listen, I'll go through this process with you," and I remember, like, it was right around Thanksgiving, and she's like, "Well, this is, like, the last time we're gonna draw blood because 'cause we're gonna know we're gonna know one way or another how this is gonna go."
Wow.
And my levels increased, but it wasn't, like, as much as she would have thought that they would, to, like, clearly say, like, "Yeah, this is a viable pregnancy."
Your HGC levels. Yeah.
And so we just kinda waited, obviously, because it was, like, the holiday, and I think we were out of town, we took a trip, and this whole time I'm still spotting, and then the spotting had kinda subsided on that trip. And we got back, she came and did an ultrasound, and, like, there's a heartbeat, so we're like, "Okay,
Mm.
like, here we go."
Yeah, I kn it's really interesting. I didn't realize that how common spotting can be as a variation of normal until my second pregnancy too, because I
Yeah,
was asking around and I kept waiting, like, for something to happen, and, for listeners out there, obviously, it can mean something devastating, but sometimes
yeah,
it is just nothing. I mean, obviously, it's
yeah,
something is causing it, but it can just be benign, and they
yeah.
don't really talk about this, so
No, they don't, and
no.
I was also in my head about this because, I don't mean it like this way, I should have gotten RhoGAM. Like, I have the RH factor, and
Oh,
because my husband and I have 2 different blood types, and
yeah.
but I declined it. I had after my first delivery, we did blood checks, everything was good, there was no, like, crossover, there was no antibodies, so I declined it because just the information's mixed if it actually
Yeah.
really does its job, and if it
Yes.
could increase miscarriage in the future. And I just kinda felt like, well, either my body's gonna do it,
Mhm.
or I'm not gonna know that everything would have been fine because I did RhoGAM and RhoGAM did it. So
Mhm.
I'm not even sure I wanna have more kids after what I just went through. So I
Yeah.
just declined it. And so when this happened, in the back of my head, I was like, "Oh my gosh, is this because
Oh,
I
yeah.
declined and there's, like, a crossover in blood?" But we also checked that throughout my whole entire second pregnancy, and there was never any cross-contamination, and everything was good in that regard as well.
Yeah. Yeah, RhoGAM is so layered. That's another interesting conversation.
Mhm.
So you did not take RhoGAM after your first? Yeah, that's what you're saying.
Or my s
And what did Oh, yeah, and what did your midwives say about your decision to decline? Did they push you on it to take it?
um, my first midwife was more for it than not, and of course, I was in the hospital postpartum this time, which was a whole different layer I didn't really anticipate because we also declined vaccines, and because I had been in labor for so long, one nurse did look at me and was like, "You're really risking your child's life by not giving him vitamin K," and I was like, "We're declining it."
Oh god, I know. And it's so exhausting to have to put up that fight after what you've been through.
Oh my gosh, I know, my brain wasn't even in my body, but it was in the regard of I knew they were gonna push me, and I knew it was gonna be a thing, but I
Yes.
also had heard that I needed to be civil,
Yeah, I
or there
know,
could be
right? You have
another
to
problem.
put
I'm
on the
like,
act. play the game.
So
Okay,
they
we're
kind of
friends.
push more on that side of things and even more so like the ROGAM.
Wow.
Yeah. Yeah. So,
Wow.
but I just, was like, "Okay."
Yeah. Bye.
Yeah.
Now, fast forward to Silas.
Mhm.
When did you go into labor with him? How many weeks along were you?
Girl. I don't even know
Like
if I'm allowed to
43.
say. I was 42 and 5, and then I, like, evicted him. I was, like, so done. Yeah.
Wait, so your home birth midwife let you go to 42 and 5?
Mhm.
Oh,
Mhm.
oh. Yeah, yeah, we
Mhm.
we won't talk about that on here, but there's some ways you
Yeah.
can get around
Yeah.
that.
Yeah, I
I'll
did.
let you listeners figure out how that
Yeah.
could work.
I did a scan at 42, like, I did decide to go get an ultrasound to, make sure fluid was good, that
Oh,
baby was
yeah.
good, all of that stuff, so all of that checked out, and she told me the risk, and,
Yeah,
she gave me all the information, she broke it down, and we
yeah.
decided that we're just gonna monitor,
I think
we're gonna
that's
move forward,
wonderful. Yeah.
and then Johanna was done at 42 and 5. I could
Yes, I
not
so get that.
bear to go another
Was
day.
was he remind me, was he a summer baby?
Yeah, so
Yeah,
actually
that's
my
why, that's
kids
why.
my both of my boys, their due dates were 2 days apart.
Oh my gosh.
So when I went late with Dakota, my first, I thought for sure this baby stupid me, I thought for sure this baby would be born closer to his due date. Then it
Right.
came and went, and then we're coming up on Dakota's birthday, and I was like, "Oh my gosh, they're literally I bet he's gonna come on Dakota's birthday. They're gonna share a birthday."
Oh
And he
my
came a whole 7 days later.
yeah, I was pregnant with Julian, well, and Lucy too. It was the summer, but Julian came in late July, just peak Florida heat, and I was 40 weeks. I cannot
Mhm.
fathom. I'm all for going into labor naturally, no matter how late that is, for the most part. There's obviously going to be
Yeah.
nuance here, but I just can't fathom being almost 43 weeks in the
Mhm.
summer in
Mhm.
Florida.
Mhm.
Brutal.
It was.
Brutal.
It
Were you
was.
just, like,
Yeah.
walking around with, like, one of those hats with the fan on top and, like, the water spray bottle?
Yeah, I
It
was
would
just like
so be
in my mother-in-law's pool and then just, like, barely any
floating
clothes
around.
all the time, like, when this baby has to come out, right? And I'm trying to, like, curb walk, and I'm, like, sweating, and I'm like, "I can't, like, it's so hot, like, I can't do this, like,
Y
why am I still pregnant?"
but I know you're probably not gonna take castor oil shots to get him out because
Uh,
of what happened the first time, so or did
so
you?
well, this is yeah,
No
interesting
way.
that you brought this up. I did not do castor oil shots, so I did let her do, a cervical check, and
Okay.
so I did let her do that,
So
and
a membrane sweep?
a membrane sweep, yep.
Okay.
So I did let her do it, and we just kinda wait, like, there were some other tinctures that she recommended that I take, and I did some sort of, like, walking with it. That didn't do it, and so
No.
she's like, "You can do midwives brew," and when she mentioned the word castor oil, I was like, "Hold up, like, I don't think I wanna mess with this again," but I also am so done, and
Yeah.
so the discussion around that was, like, it's not gonna have the same effect as taking, like, straight shots of castor oil,
Yeah.
and so I made my little midwives brew, and I drank it, and I was like,
You're
80% of the
so
time it
brave.
works. I took a nap because I heard that you take it and take a nap because it's probably gonna work, and I woke up and nothing happened, and I was like, "I am the 20%." But later that night, I did go into labor.
Wow, thank
I
goodness.
know.
So how long was this labor?
So this one was, like, about 14 hours, so, like,
Only
much
14 hours.
shorter. I
Right.
was hoping for, like, 6, but no, we were
Right.
still had a good 14 hours.
Oh my god.
So it wasn't as bad. I do remember, like, once things finally started rolling, like, then I was like, "Okay, I knew this was gonna happen," but it was, like, coming up close to my son waking up, and my labor had stalled
Mm.
because I think just, like, innately, I was like, "He's gonna be awake," and, like, I'm not a quiet birther, like, at
Yeah, we
all.
roar.
Yeah, yeah, so he woke up,
And
my
so
mom took him, and then we just rocked and rolled. Then we just, like once that happened, it was, like, just rolling, and everything was going, and then I had him in the tub in our kitchen, and all of that was great and beautiful, and then I had him lifted up on my chest, and I was like, "Something doesn't look right."
so something visually didn't look
Mhm.
right.
Yep.
Okay. So you knew instantly, and then was the
Mhm.
midwife kind of looking like, "Hmm, what's going on here?" Or did she know medically what could be going on?
So, like, the midwife I had as, like, a birth assistant has another midwife, so between the 2 of them, like, once they did the exam, they had figured they knew it was, like, hypospadias, however, they had, like, no true, like, information, they didn't see it very frequently, they just basically said, like, "This is what we think that it is, and we recommend that you follow up with your pediatrician for further evaluation and recommendation."
Can you explain what hypospadias is?
Yeah, so hypospadias is where basically the urethra doesn't go to the proper area that it needs to be formed at. So, like, and obviously, boys, it's like at the tip of the penis. So, Silas's urethra was actually like at the bottom of his penis, like right above his scrotum. And so it visually had looked like there was like a hole where the urethra should be. So that's
Right.
where it was like very confusing with the lack of information. I don't even think I noticed the original like hole where the urethra actually was until like maybe days later. I mean, I just
Wow, yeah.
thought like I don't know what I thought. I just was like, well, that's not normal, but that's definitely not where his urine is coming out of. It's coming out of the tip of his penis where it should be. And it definitely wasn't. And I had talked about like obsession. And this is like such like a I hope this helps other parents and other moms that go through this because like I was obsessed about this. Like, I was constantly,
Yeah.
like, trying to, like, lift up his penis to see if there was urine come out of it. Like, I was trying to get him to pee. Like, I was trying to make sense of this scenario. And a lot of times when boys have hypospadias, they also have, like, an associated condition called cordy, which is, like, basically, there's just so much foreskin. It almost and it the base, the bottom, like, skin of the penis is, like, almost, like, tied down like a tongue tie would be.
Wow.
So, they call it, like, a hooded penis, so, like, you can't really see the anatomy fully,
Yeah.
and Silas had a pretty, like, severe case as far as, like, the urethra location and what it would need to take to repair it, but there are also, like, more severe cases where they can see it on ultrasound because the anatomy is so distorted, or they're not sure without an ultrasound on the child if it's female or male, and so there's
Wow.
just it can get more, like, intense in that regard, so I mean, I guess in that I feel blessed for his, like,
Right.
diagnosis, but also at the same time, it's, like, highly devastating because I did this great birth and I was redeemed, and I got my home birth, and then a second he came out, I knew there was a problem, and it was just devastating.
Now, if he was still urinating out of the tip of his penis, right?
Mhm. Mhm. Well, he was not.
Then oh, he was not. So the
No.
urine was coming from
From that
beneath?
Yep, from beneath. Mhm.
I see, I see. Yeah, okay, so then it was,
Mhm.
like, very clear what was going on. So, did you first see a pediatrician that you had already been seeing for your firstborn to get him checked out?
Such a
Mm,
We had taken him to a pediatrician, yes, and we had to anyway because we couldn't get into a pediatric urologist without a referral.
right.
Isn't that
Yep.
fun?
Oh, I know
Just
how
can't
that
even though I'm
goes.
cash pay even though cash
Yeah,
pay, I couldn't just waltz in there. So, yeah, so we'd taken him the pediatrician knew that it was hypospadias, had no idea the severity of it, though, I will say that. Had no
right.
idea, just literally said that, "It's this, you need to go follow up with the pediatric urologist, they'll have more information. This is your referral," and that was it, and I called and that like, the second we left the office, and they were like, "We can get you in like 6 weeks." I'm like, "Excuse me? My
That's not gonna
son
work.
urethra is not in the right position, and you're gonna tell me I have to wait 6 weeks?" They're like, "Is he
Right.
urinating?" I'm like, "Well, yes." And they're like, "Yeah, that's the earliest we can get you in." "Okay."
Wow. Yeah, it's a little
Mhm.
bit shocking when you put it that way. It's almost like you're calling to ask for, like, a cosmetic procedure. Like, "Yeah, I wanna get some units of Botox." "Yeah, we can squeeze you in 6 weeks."
Oh, yeah. Yeah.
Wow.
It was and there like, in our area, there's one option. You have to go to all children's, and when we had a bad response, I'm like, "I'll go get a second opinion in Tampa," and they're like, "The same urologists that work in this location are the ones that go to Tampa, so there's
They
no
have
point."
a monopoly.
Yeah, and I
They're like,
was
"You
like
don't like us here? You don't like
yeah,
us there." Is
I'm
all
like
children's Johns Hopkins?
yeah.
Yeah. What do you think of Johns Hopkins Hospital? You're like,
I
"I have a
don't
lot to say."
yeah. Oh, I feel like I can't make, like, a fair assessment. I can tell you about my experience that we had, but it was not good,
Yeah.
and, I don't like that like you said, it's like a monopoly. I don't
Yeah, it feels like a
and
big corporation.
Yeah, for sure. And like I said, we are cash pay. So like we couldn't even they wouldn't even like I mean, I was kind of done with the facility in general after our first experience, but like there's other doctors inside of that, inside of that office, but like we weren't even able to like see somebody else. So it was just like it wasn't a good experience overall for us.
When you say you're cash pay, do you still have some kind of medical insurance, but you're opting to do cash pay to get around that system, or do you have no medical insurance at all?
Well, at the time we had like a Christian co-op
Okay.
sharing.
Okay.
And so we were using MediShare and we had that, but of course the pediatric urologist did not take it. There were not no like
Interesting.
none of them. No one in our area really takes it actually. I recently got rid of it in the last 3 months because I was looking for a provider and like anyway the company was pretty bad in the regard of like there would be listed all these providers that would take it, and then when you actually call, they were like, "We absolutely do not take that." And then the company, like MediShare company would be like, "Well, you need to call all them on the list, and if they tell you that they don't take it, then you need to report it to us." And I was like, "This is not my job."
Yeah, that's definitely not something you have the bandwidth for.
Yeah,
You're not paid to do that.
yeah,
Okay, wow. So
yeah,
yeah, this is really eye-opening because I do know a lot of people that do have those insurance alternatives, so this
yeah,
is really helpful to know too.
yeah.
So the first point of contact you have with a specialist, what was that
Mhm.
conversation like in regards to Silas's hypospadias?
Well, we went into the room and the doctor walks in and he takes off his diaper and he pulls up his penis and he puts it down. He puts his diaper back on. So all within 10 seconds or less. And he goes, "Yep, he has hypospadias."
You're like,
I'm
yeah,
like,
no shit.
"Okay."
Or where?
He goes, and he has a pretty severe case of it. And I'm like, "No, no, 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 no. No. I don't think you
Oof.
noticed this." And he's like, "No, it's proximal, blah, 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 all like these big terms." And he was like, "And so we'll need to see him when he's 8 months old and we'll do a correction. It'll be one surgery. It'll be as simple as like a circumcision." I was like, "Well, I don't want to
You're like, we're not
circumcise."
even doing that.
I'm like, I think that's a huge deal." And
Yeah.
he like just I started crying and he was like,
Mm.
"Oh, please don't do that." And I'm like,
Never ever
"You
tell a
literally
mom that.
just blew up my world." Like I had over those 6 weeks before that appointment, I had convinced myself through the research that I did that his case wasn't bad, that it wasn't gonna be bad. It probably didn't even need to be corrected. And then he just comes in less than 10 seconds, puts a bomb on me, and then tells me not to cry and everything's gonna be fine, and in one surgery, it's gonna be fixed, even though it's so severe.
It just shows like so many of these specialists do not have bedside manner. But the other
Mm-mm.
problem is they're so deep in their world of what they do, and it's not their child, that
Mhm.
it's not like a circumcision is not a big deal to them. This
Right.
surgery is not a big deal. They
Yeah.
forget like this is a huge deal for
Yeah.
you.
Yeah. I mean, there was never a conversation of like, how did you just getting to know us, like, did you wanna circumcise? Did you know like, any of the
What are your
things, like,
plans? What are your
none of the things.
goals? Your
Yes.
values?
Yes. Do you even wanna I know it's a severe case, this is what we recommend, this is the outcome this way or that way, do you how would you like to proceed? Nothing. It was literally like, "See you in 8 months, he may need, like, testosterone," and I was like,
Now we're talking about that.
"What? Like, are you kidding me? This is my baby. We're gonna pump hormones into him?"
Oh my god. It's like
So they
literally one thing after the next.
Yeah, and they do that with some kids, and I'm not saying it's right or wrong. I mean, honestly, if you're inside of that, like, industry on, like, how to correct hypospadias, there's, like you have, like, 10 surgeons, they all practice, like, different, basically, and so there's different protocols and this and that, but I didn't align with putting any type of artificial hormone into our kid, our baby. I
And this
definitely
was
didn't
at one of the
align.
most major hospitals in Tampa, correct? For children?
Oh, I mean, in St. Pete, yeah.
In
Yeah.
St. Pete, so in the Tampa Bay area. One of the best, most renowned hospitals in the
It's
country.
the pediatric urologist office is connected. There's a walkway from All Children's Hospital. Babies are born there each and every day. The nurse told us they see over 200 cases a week because the babies are right there and they're born and they come in for circumcisions because most people circumcise their kids. And so they see it and a lot of times if you did not circumcise your son, most cases of hypospadias are minor, where the urethra is just like right underneath the foreskin, just slightly in the shaft, like, not like, most people don't even correct it because, like, they can do all the things they would normally do.
Okay. Right,
So,
it's functioning, so you
it's
wouldn't need a
functioning.
revision. If it's not
Right,
functioning,
right.
you need to do something,
Yeah, right.
right?
So, they're seeing all these cases all the time 'cause they're right there at the hospital. And then we come in off the streets and they're like,
Whoa. It just shows how really expert they are. So,
"Mhm,
what I have to ask you from your personal professional experience, what do you think distinguishes a parent who would just agree on the spot, maybe be devastated, but be like, okay, let's move forward with that recommendation, doc. You're the expert. I don't know.
mhm,
Especially in this day and age with
mhm,
ChatGPT, Google,
mhm."
whatever, versus a mom like you who's like, whoa, 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 whoa. Like, we're not going to do any of that. What do you think distinguishes type A from type B?
I mean, obviously experiences, right? Because I got here from an experience, from living a tragic thing that made me question,
Your brother.
yeah, the system. And I think that I know other people go through similar things like that, but I don't think all those experiences, like, open up someone's eyes to think that, like, well, maybe there's a different way, and maybe we
Hmm.
need to ask more questions and, like, really, like, self-empowerment and know that, like, this is our body, like, and this is my son's body, and we have the right to ask questions. For me too, like, I'm in quote unquote "healthcare." Like, I
Yeah.
have a chiropractic office. I'm a cash pay office. It's people's option to come in and see me and to accept my services and my care. And all of that happens around proper communication, informed consent, having conversations with these patients that come in. So a lot of them, when I speak to them, like, they don't feel like they can even ask questions. So imagine going
Mm.
to an a surgeon and having all this, like, heavy things just dropped on you, having no idea where you stand. Because if I would have walked it a different way, if I would have said, like, if we would have reversed and said, okay, the midwives say it's hypospadius. They say, "Go to your pediatrician." I would go to my pediatrician. My pediatrician says, "Oh, yeah, it's hypospadius, but, like, go to the urologist." And the urologist comes in, and he does probably what he does to most people, and he goes, "Oh, yep, it's a severe case. We'll see you in 8 months." Most people don't even think about asking a question. They're just like, "Yes, you are the expert. Of course
I'm
I will
way too
do."
skeptical for that.
I mean, me too. I'm like, my alarms are going off, and I'm like, and I think even in some cases, a mom's, like, gut may be going off, but they still maybe this is the first time that they're in this type of position, and they don't
Yeah.
know. They don't know. Just like we talked about, like, trying, not vaccinating my kids in the hospital, my first, and the pushback I got for that. Do you know how many people would have caved?
Oh, yeah, and they do. Or they know vaccines are bad. They don't want to do them, but they get scared for other reasons, like the potential threat of CPS being called, which
Yes.
I know really does happen,
Yes.
unfortunately, to certain people. So I'm not saying that that's a made up fear at all. I'm just saying, I just have a real quick side note question about that. With your first at the hospital, did the nurses and staff know that you are a chiropractor when you were declining vaccines? Did they know about your profession?
I think that they did. I feel like they
Hmm.
did because I know several of the midwives there.
And were they some of the ones who were the pushiest with, like, "You need to give your babies vaccines"?
No, it was the nurses.
The nurses, yeah.
Yeah, it was the nurses
So
for sure.
interesting, the dynamic.
Yeah.
Okay.
But yeah.
It's just interesting because you both are in healthcare, but, like,
Mhm.
they don't understand chiropractic, we know this.
Yeah, yeah, yeah.
Yeah, yeah. The misconceptions. Yes, that's true. So, okay, going back to how many specialists did you have to talk to ultimately before you decided, like, "Yes, this is the one that we wanna work with"?
Yeah, so we only talked to about 2 of them. Like, we had seen the person in St. Pete, and then I, got as soon as we got home, I got on Google and I was like, there just has to be a different way. And I just start, like, looking, like, how can we do this? Like, can we do this without circumcision? And an article had came up by a pediatric urologist, Dr. Snodgrass, and it had talked about, how he has corrected some of these cases without circumcision. So that's kind of how I found his clinic that's in Texas. And I was like, oh, there may be hope for us.
Mhm. I find it fascinating that not only were you dealing with the very real consequences of hypospadias, but they were also had you not pushed back, you were going to go through a circumcision for Silas too, potentially,
Which
correct?
yeah, yeah, which we did end up doing because so the first person we consulted with in Tampa or in St. Pete said 1 surgery, 1 and done.
Mm,
The clinic, so we decided to go with the Hypospadius clinic, which is based outside of Dallas. It's like in a little place called the Colony in Texas.
yeah. Oh, yeah,
And
I
they have
remember the colony.
yeah,
Yeah, yeah,
and
yeah.
they have a clinic there for hypospadius
Okay.
repair. That's all that they do. They don't do other
Wow.
things. That's
Very
all that
niche.
they do. Each and every day, 5 days a week. And so when we had consulted with them, I had, we had told them that we would like to try to see if we could do this without circumcising him.
Yeah.
And they did a good job of informed consent, pros and cons. And they said, well, you can. The difference between that and us doing it with a circumcision is he needed 3 surgeries to properly repair this. And
Brutal.
so the second surgery is where they actually like cut. I mean, it sounds kind of graphic, but they pretty much like splice open the penis because they have to make a urethral canal. So they have to graft it. They have to skin graft it. And you basically have 2 options. You can use the foreskin if it's there, and that's the most
Makes sense.
closest to normal skin,
Yeah.
or you can use this day, like in this time, they use buccal tissue, so from the inside of the
Okay.
cheek. So if we did that, he'd have to get a graft. Like
Oh
he'd
my
have to cut his tissue and graft it. And actually, prior to us meeting with them, I had just been doing research and like going through and I'm reading all the stories and from like guys that had this done like years ago, decades ago, and then even like more recent stuff. And like back in the day, they used to use like your thigh skin, and then they were
Wow.
reporting that like hairs were growing inside the urethra because like they had hair follicles. And I was like, okay, so now we have to decide like, do we choose tissue that's just not as close to how God made him, or
Right.
do we choose to circumcise him? And so we
That
did.
actually is, I have to say, probably the only reasonable excuse for a circumcision.
Uh-huh.
Like that
Yeah.
actually makes sense to me. That
Mhm.
adds up. And that's a great way of using the BRAIN acronym. This is thinking critically because you are left with no ideal solution. In a perfect world, you'd never even be confronted with this.
Yeah.
But I agree with you. The best option would be to use the foreskin. Like this is for
Mhm.
a functional medical purpose that is going to
Yep.
be life changing. This isn't for vanity and obviously it's not an easy decision, but yeah, when you explain the alternatives to me, I
Yeah.
get it. I
Yeah.
totally get it.
And technically, like, all of his surgeries were, like, optional. Like, they weren't, like it wasn't life or death. It didn't absolutely have to be done. But with the severity that he had, when we thought about his future and
Yes.
just his ability to, like, even do some like, he wouldn't be able to pee standing up, which wasn't the biggest thing that was on our mind when we were making these decisions. But because of where his urethral location was, he wouldn't be able to have children, at least, like, not the God-given
I was
way.
wondering about that actually, and I
Mm,
think it's so wonderful that you did decide to go this route, like for that reason as well, because there's no doubt it is better to get this out of the way on his behalf as opposed to
yeah,
him having to deal with that later.
yeah,
Like what a nightmare to deal with that later on
yeah.
his own.
For sure, and, I know tons of parents, like, on in the Facebook groups and stuff that are, like, anti-surgery, and they're like, "We'll let our child decide," and all that stuff, and that's where I'm very passionate of, like, let people decide what's right for them and, like, try to empower them to have the right questions that they can ask to get to that final decision. But for us, like, when I think about anatomy and what I know about it and the tissue and stuff, like, and the surgeons also telling us, like, it is easier to repair when he is very young versus
Yes.
when they're older. Just like there's just multiple factors that went into that, but also like if you think about your skin tissue and repair when you're young, it is so much more regenerative than what it is when you're older.
Oh
And
yeah.
so I was also coming from the place of understanding scar tissue and healing, and I just wanted to make sure that like he had the best chance of success and also the less amount of like mental load on him around this whole
Yes.
topic.
Yep. Wow. It's like you and Peter were faced with so many complicated decisions on behalf
Mm,
of Silas at once. But what I really admire about your process is you didn't succumb to any out of this false sense of urgency or fear of like pleasing a doctor or not really fully understanding all the alternatives at your disposal. I
Mhm.
think this is the key point. How long did it take? So, from the time, Silas was born, you recognized this was an issue to the time you decided to, okay, now we're actually going to have this procedure.
Mhm.
How many months had passed?
So, he was born in the beginning of August, and I wanna say by October,
Okay, so about
we
2 months later or less?
knew yeah, we knew we wanted to use the surgeons in Texas because his case was extreme, and they were doing these types of corrections on his severity several times a week for years. So they used a different technique than other surgeons do, so their outcomes, like, when you look at them, were better than some other techniques. So, we knew they were the right fit for us, and so he had his first surgery, like, right around 6 months. So that was right actually at the very beginning of January that year.
And so from that point on, right, because there's always going to be this like fork in the road, like, okay, there's going to be some things you have to do inside the medical system,
Mhm.
then maybe some things you get to choose to do outside of that system.
Yeah.
As a holistic mom, how do you and your husband ultimately decide on behalf of Silas whether you're going to involve the
Mhm.
Western allopathic system versus whether you're going to support his health like at home or through more natural methods?
Yeah. We had to blend the 2 worlds. Like, there was no way around it, and I think that's important to note and to definitely speak to the moms that are, like, on the holistic side, because I've seen this, like, endless times on the internet, is that some parents get a lot of shit for, like, giving their kids, like, Tylenol and things like that, but when your child's in pain and they're going through a medical procedure, all the arnica in the world's not gonna help. Like,
Absolutely.
and it's not fair to them, in my opinion, to do that. So we blended as much of the worlds together as we could, and I did try to talk to his surgeons about some of the alternative things that we wanted to do, and they just didn't have the knowledge around it. So it was just, like, up to me to feel like, is it a good decision? Is it safe to do that for our child? So with that being said, like, we had to do an antibiotic with him because he had catheter with
Yeah.
so we had to decrease infection risk. He needed pain meds, so we tried our best to make a cleaner option with that, right? We didn't just go
Yes.
to Walgreens and buy the kids Tylenol and the kids Motrin, like, we did Genexa, which worked
I
just
love
as great.
Genexa.
And then we did do Motrin because we had to alternate them, but we did the dye-free one, the cleanest version you can get of a Motrin.
Yeah.
So we did that, like, all the way through with that, and, then after that first surgery, I started thinking more about, like, well, what are ways that I can properly support his body pre and post-op? What are, like, things that we can do? What are supplements we can take? Because the anesthesia 3 times before 2 was a big concern for me, and a concern as far as, like, mental development too, and that's hard when your child's young and they can't communicate, and you don't know if it's
Yeah.
gonna cause a problem until they start to develop and get to
Right.
those milestones and those ages. So I just figured if there was anything I could do to, like, open drainage pathways and help support his body,
Yes.
like, it wasn't gonna hurt anything.
Absolutely. I think that this is such a wonderful testament to how much power we still have in a seemingly very powerless, highly medicalized situation.
Yeah.
And sometimes it's all the little things that can add up. Like it does make a difference, I think, if you have the choice between the dye free Motrin or
Yeah,
Tylenol and not, because
yeah.
especially when you're taking it so frequently. And opening up the detox pathways is incredible. Like, were you doing magnesium baths and like other things like that? Or how
Yeah,
exactly were you
so
doing that?
I did a few there's a company called Wild Holistics. I don't know if you've heard of
Mm,
them. They make different, like, tinctures, so they had some really, like, gentle ones that you could use on, like, younger children, like babies within that first
yeah.
year, and I was also breastfeeding, so I was taking some of these things, so he was getting it through the breast milk, but make sure we were doing, like, a liver protector, we were doing, like,
Mm,
histamine support, opening up his drainage pathways as much as we possibly could, and, then I was also supporting his immune system too because he can't get sick. Like, you can, but, like, once you get close enough to your surgical window, if you get sick, they have to reschedule it. And you're talking about we're
ugh,
traveling, so there's so many things in this mix.
wow.
that you had to, like, consider, and we actually had our oldest in, a Montessori school leading up to, Silas's first surgery, and we pulled him out. We I
I
just
get
it
it.
we just pulled him at the end of November, like, he went on, like, Thanksgiving break, and we didn't send him back.
I totally get it, especially that time of year.
Mhm.
Did you have your mom help watch him while you were at work, or how like, who was watching him?
So, we had my mother-in-law helped with that with him at that time, and we had, like, some nanny help across the time, and
That's great.
yeah. Something else that, like, we don't talk about very often is that, like, actually right before we came up on Silas's first surgery was right still, like, as COVID stuff was still happening, and we had made it through this whole entire COVID situation without getting tested for COVID,
That's amazing.
and they were like, "You have to get tested.
Uh,
All of you,
they
anyone."
said this in the hospital.
Right before, well, so when we go to Texas, it's a surgical center,
Oh, right.
and so their rules were everyone, including the patient and the parents, had to get a negative COVID test within 48 hours. So because we were traveling, we could either do it here, and it had to be so many days prior so we could still quarantine when we got there, or we could get it when we got there, it just had to be within 48. So I'm like, These
Yeah.
rules don't even make sense, so this is so ludicrous." And then maybe, like, 2 weeks before we were to fly out, they lifted the
Thank
surgical
God.
center lifted that requirement, and I, like, just took this big breath because it was, like, such this added complication
Yeah.
because I
That's
was just
so
like,
many
"What if we get a
barriers.
positive test? Like, I don't know."
Right. And it could be a false positive, but also it's like, okay, so you're going to test me for COVID, but you're not going to test me for a cold, a flu. What if I have COVID, but I'm asymptomatic? You know what I'm saying?
I know what you're saying, yes.
I
Yeah,
mean,
so it
we've
was
been dealing
like,
with this for
yeah,
years.
it was this crazy, crazy,
Crazy.
crazy, crazy time, and yeah, I think maybe since I feel like I can say this on this podcast, it may be helpful too. I'm not a proponent of lying, but they do ask
I love the butt.
they do ask on the intake forms, and parents have asked me this, how to navigate it. Like, they ask, like, "Is he up to date on his vaccines?" And I'm like, "This is not a relevant question to what you're going to be doing."
Yep.
So, he is up to date in the regards of what we opt to do.
Yeah, yeah, I love that answer. It's so subjective. It's so open ended. So just
Yeah.
interpret it however you want.
Yeah.
As someone in the healthcare space, I know that you obviously don't ask your patients that, but if you had to
Mhm.
get into the minds of these corporations, the ones who are ultimately in charge of designing these questions, why do you think they really want to know? We don't, I mean, some people are going to say it's a psyop or, it's surveillance, which, yeah, it absolutely very well could be. But do you think it's more like they want to call CPS on people? Or like, what do you think the real reason for a hypospadius procedure that he's up on vaccines?
I think from their perspective, it probably deals more of, like, that's just, like, they're in the medical world, and, like, those are the boxes that you check, that, like, of course you would be, like, hitting these, like, quote unquote, like, milestones with these vaccines. I think also too, and I do get this because I thought about some of this stuff when we were going through it, it's like there's 2 surgeons that do it there. So, like, I think that they feel like if everyone's up to date on the vaccines, they have a lesser risk of getting sick and exposure.
That's cute that they think that.
I know, I agree. That's my thought. I don't know if it's true or not, because this is the other thing too, we win. And right at the end, like I said, that first one, they had just lifted that mandate, and, like, the surgeons come in the room, but they keep a far distance from you. They have their surgical mask on when they come in and they're talking, and so, like, we're not, like, on top of each other. We're not even in a small room, like, right next to each other talking. It's like a
Yeah,
decent sized room that you get to sit and wait in, and they just come right inside the door and they talk to you, and then, they're off. So
right.
it's for me, I'm like, and then if my child is, presenting well, like, he's doesn't have a fever and doesn't have symptoms and all these things, and you're putting him under anesthesia, like, I don't know. What are we worried about?
You mentioned something interesting. So, because of the anesthesia exposure, that's why you were more keen on, doing some detox and opening up the detox pathways. For listeners out there who are not aware of like some of the side effects of anesthesia long term, can you talk to that a little bit?
I will talk to it from, like, what I understand, because I'm
Yeah.
definitely no expert, but from my research and understanding, like, there is a risk. I mean, there's a risk with anything, right? Even going under anesthesia as an adult, but for children, there's a risk of, like, brain development and how it can affect that and have a negative impact on that. So that could be anything from, like, speech delay to, like, behavioral issues, like, just different things like that. that was a scary part for me because obviously the anesthesia was a necessity to do these
Yes.
procedures, but and I felt like the risk was worth, doing it, but it was hard to accept that. It was hard to think that possibly one of the 3 times that we put him under, he could have like a negative response or maybe that something went wrong and that could negatively affect his brain and his development. And that would be something that I would have to live with that I chose to correct, we chose to correct this for him. So we therefore chose to put him under anesthesia. And therefore, in my mind, it would be my fault that this would happen and
Mm,
cause like a delay or cause a behavioral change, something that like I was hoping we wouldn't have as many risk with, with not vaccinating and giving massive exposure of different toxins to our child.
what would you say to a holistic mom out there who is maybe deep in her dogma, who's like, nope, under no circumstance will my kid ever be getting Tylenol, Motrin, getting a surgery? What do you want to tell that mom?
You don't know what you don't know.
Yeah,
Until you can put yourself in that situation because you are in that situation, you should never say never.
I agree. Yeah,
Because unfortunately, and I don't wanna, like, say this to scare people, bad things happen.
yeah,
Like, you could be driving down the road and have a massive car accident, and your child is in the car with you and has to get taken to, whatever hospital, and are you gonna say, "No, don't provide medical care to my kid?" Like, there is a time and a place for all of these things. Are they overutilized and overpushed and poorly explained and all this stuff? Like, of course. But when you're in a scenario of needing medical intervention, some of these times, like, you have to follow through with what the recommendations are.
yeah. I think what's really scary is over the last year or so, it's come to light that there's certain extreme holistic personalities on social media who have gone so far as to suggest, like, oh, if my child was in a car accident, like, I would just want them to will that they have their life. And I think that kind of influence is obviously extremely dangerous. Obviously, the
Yeah.
best way to be is, yeah, for everyday normal situations, like if your normal healthy child gets a cold or has the sniffles, we don't need
Yeah.
to reach for the Tylenol, right?
Yeah.
But like, yeah, our children who are undergoing major surgery should not have to suffer in pain, and that
Yeah.
Tylenol exposure should not be making or breaking it. We don't have to worry about like the autism and Tylenol
Yeah.
connection. Like that is not the time or the place to be worrying
No.
about that. We need
No.
to get our priorities in order.
Those moms can come back and talk to me when they have to walk through my shoes.
Yeah,
Like, and until they do, like, and if they don't, like, don't be commenting on something you don't understand because they can say
absolutely.
that all day. It's not the same thing, but it used to be also like I would say to my mom, like, "My life will never change when I have kids. I'll still do all the same things I used to do." And do you know how
Not at
much she
all.
loves to rub that in my face? She's like, "You," and I'm like, "Okay, heard, like, I know."
You're
And
like,
I hear this
fine.
all the time in my profession too from other professionals that um service like pregnancy and postpartum moms and they don't have kids and they're like, "You should do this." I'm like, "Okay, well, until you're in my shoes and you have a kid screaming at you, having a
Yeah,
tantrum like 5
yeah,
times a day because their brain's not developed and they don't know how to handle their emotions, I don't want your
yeah.
advice."
Completely. I always say that too now. I'm like, if anyone's giving me like business advice, whatever it is, and they don't have young children with
Mhm.
them,
Mhm.
I don't want to know what it is.
Yep. You're not
I
for
don't
me.
need
You're
it.
not my cup of tea right now.
Do you think that because of this very niche surgical center in the colony in Texas, because they're doing so well, they're so niche,
Mm,
it's less invasive, that this has become a source of big competition for places like, the big hospital in St. Pete, or is St. Pete, they're not worried about that. They're
I
just
don't
like
think
too small and obscure.
I don't think that they're worried. I meaning, like, I think that a lot of people are gonna do like we talked about earlier, they're not gonna ask questions, and they're just gonna
Mm-mm.
do what they're told. So, I also think that even if they do ask questions, then they're gonna think that their insurance doesn't cover it, and how in the heck would they pay for it out of pocket? And that they don't have the funds to do so. So, therefore, they're gonna just go to whoever's, like, the local choice that is, quote, unquote, "on their insurance." What the sad part of some of those things are is that a lot of the cases that this Hypospadias Center does see is corrections to bad surgeries.
Meaning you're double paying. You're paying for the first
Mhm.
one that
And
maybe
then
insurance partially covered, and now you're gonna pay this is just like with anything in life. I always
yeah,
say to, my husband when it comes to buying clothing, because he actually does really care about clothing quality, but it's easier to get in Sweden, his style, and then
yeah,
here it's like maybe, taking some shortcuts, right? And then you kinda see it's, like, falling apart in the wash. And I'm always like, "Well, if we just spent a little bit more here on,
yeah.
the better clothing item, then we wouldn't have to worry about the repair later." Everything.
Yeah, yeah, and then if you take it and you think about, like, the reason that these families or even adults are getting these repeat surgeries is because the other surgeons I don't wanna say they messed up because that's not fair, like, I don't know the inner workings of all that stuff, but the outcome was not the result that they wanted, and then you
Right.
have scar tissue, and then you have to repair again, and it's harder every time there's scar tissue, and it doesn't
Yes.
work the right way. Unfortunately, I don't think that I know that clinic is busy. I know that they are. And I think they will continue to be busy. And
Yeah.
I don't think that they're taking any business from any of the big centers because I think that people are just conditioned to go to the closest, the one that's on their insurance and not ask the questions and not even think because sometimes they are good at telling you that they either don't tell you the actual like percentage of like poor outcomes or you don't think to
Oh,
ask
of course.
because you don't
Because you're
want to
not gonna wanna
know.
go. Well, you're not
Right.
gonna wanna go if they're like, "Well, we have, like, a 40% failure rate." So, "Okay, bye."
Yeah. Yeah. Yeah, for sure. But I have talked to several families that are actually traveling internationally from, like, I just spoke to a family in Germany, and they're actually going to be in Texas in April for their son's first
Wow.
surgery. Yep.
When you spoke to them, are there just not great hypospadias options in those countries?
So when I had chatted with them, they had met with several professionals in around the area and the outcomes were not good. That didn't
Oh,
seem like they were as, like, well-versed in more extreme cases, like, what their son has a similar case to our son, and, so they didn't feel comfortable pursuing
yeah.
that, and then you get on a call with I will say you get on a call with these surgeons that run the Hypospadias clinic, and they know their stuff, and
Yeah.
they have good bedside manner, and they're compassionate, and they, like, for lack of better terms, like, they entertain my questions about holistic health and wellness
As
and
they should. That
yeah,
should be the norm.
yeah,
This is going to be a touchy subject for some, but it needs to be said. So, just speaking of more logistics here, because there are going to be people that say, like, well, we don't have the savings. We
mhm,
can only go to someone that's in network with our insurance, even if that's not the best. What are some sacrifices that you and your husband have chosen to make and continue to make to be able to financially afford the better option? Even though it's out of pocket? And do you do like monthly payment plans? Were you able to pay this in one lump sum? Some things you say no to. And so let's start there.
yeah. Um, so we had honestly, the situation was kind of like confusing with our insurance that we did have. They originally said that they were going to cover it, and then they didn't.
Of course.
So
Typical.
we did pay like we paid it out of pocket. We paid a lump sum at that time, and then the clinic's financial department is really good, and they went back and they went to bat for us with our company.
Wow.
And because like I said earlier, which I think is an important thing to note, like if you do use MediShare, like these MediShare said that those surgeons were on the policy or whatever, and they
Yeah.
weren't. Like at one point, one of them, I guess, was like at a hospital, like way prior, but they never opted in inside of this clinic, but they never took them off the list.
This is kind of a scam.
Mhm. So they I don't know how it all happened, but they went to bat for us and they worked it with the company, and so they actually
Oh,
we got a portion of it covered for one of the surgeries. So that lump sum that we paid did end up, like, actually covering most of the 3 versus just the 1, like, we just paid for the first one. So because insurance did kick in for some of them.
great.
And, yeah, so that was really a blessing, and I mean, I'll just also say, like, we're blessed to be in a position of, like, if we need to borrow money from family, we're able to do so and to pay them back
That's wonderful.
and that kinda thing. So, like, for us, like, that obviously, like, I don't wanna lie about that, like, that's
Yeah.
how we were able to do that, and, as far
That's
as, like,
great.
sacrificing, like, different things and stuff. I mean, just really the sacrifice is, like, really my time. Like, it's as much as I wanted to
Yeah.
be home with my children and with my son who just had surgery, the day we got back, I went back to work, like, every time. Like, I was working until the day we left, and I went right back in the day we got back, and, my patients think I was, like, gone on vacation, and, like, little do they
Like,
know
that
that,
ain't no
like,
vacation, honey.
it was no vacation, and, still seeing patients. I'm stressed out because, like, someone else is caring for my child, and luckily, my parents were a big help to us, and they would
Mm,
help us on both sides of it, and so, like, we had some additional support because diaper changes are hard in the beginning with all of that,
yeah.
and, so that I mean, that was really the biggest sacrifice is just, like, not being able to show up and be the mom that I wanted to be and the caregiver that I wanted to be because, like, I mean, my business is the primary support of financial in
Yes.
our family.
And well, that makes sense. You're doing that for the
Mhm.
sake of your children.
Mm. Yeah.
And that is incredible. Yeah. I think people we need to get just creative and think outside of the box, whatever
Mhm.
it takes. Like the kids should come first. So if you don't have the financial means today, let's get creative. Let's figure
Yeah.
out how to not potentially have that revision surgery,
Yeah. Well,
just
and
because they're a network with insurance.
these places have payment plans, and they have different
Exactly.
options, and even with that being said, like, hospitals ha like, you can hospitals have payment plans too.
Yeah, and also you can negotiate your medical bill down. They
You
don't want you to know
can.
that, and
They
I
don't.
do that every time. I actually learned about those tricks from April. She's incredible
Nice.
with that.
The
Yeah,
fee that they charge insurance is not the actual fee. Like,
exactly. It's all, like,
it's such
made up. It's
it is.
crazy arbitrary numbers. They could charge you, like, $55 for some
Yeah,
saline, like, you just need to ask for your itemized bill, seriously.
always.
Yeah.
Always.
Is there anything else that you want listeners to know? Just any parting thoughts?
I mean, I think it's just really important that, like, if you are going through something like this, to find your support. And meaning, like, when I go through and I talk to other parents and other families, a lot of them don't feel supported by
Mm,
their friends or their family because they haven't gone through it. So it's reaching out and it's finding someone that can at least understand a little bit of, like, the road that you're walking so you don't feel so alone because it's isolating. You almost, like, fall into this, like, black hole of, like, nothingness, like, just existing. And I know some people's experience, this is their everyday. Like, they don't get to wake up and be done with it. And that has to be very difficult, and
yes.
having proper support is, like, one of the best things for that. I think also learning how to do some self-sourcing
Yeah.
and trying to hypervigilance is good, but also being aware of it too, so you can not get, like, caregiver burnout and you can take care of yourself because if you're the primary caregiver to your child that's going through something or, and definitely sick, like, you have to be the best version of yourself to do that.
Yes.
And that's okay, and that doesn't make you selfish to do that. It's okay.
No, don't
Mm.
become a martyr mother. You
Yeah.
need to put on your oxygen mask before you put on your child's.
Yeah. Yeah.
Yeah.
100%.
And by self-care, we're not talking about like, I need a spa day all day. It's like, maybe go get an adjustment. Maybe can
Yeah.
you go to bed at 9 o'clock instead of midnight?
Yeah. Yeah.
It's things that are
Yeah.
free, I think.
It a lot of it is free, and it's also, like, I think your mental capacity and your mindset, like, what are you putting into your mind? If you're constantly in these groups and they're talking about all the negative outcomes or they're debating, should you or should you not do surgery or should you or should you not use, Tylenol versus arnica,
Right.
get out of the room.
Yeah.
That's not
And, like, seriously, that's what we're talking about here, Tylenol versus Arnica? Like, we have a
yeah,
way bigger fish to fry. Like,
yeah,
will this procedure
yeah,
potentially need to lead to a revision later? Let's talk about
right.
that.
Yeah. So get out of those rooms. They're not
Yeah.
productive. Like, find a space that you can have real conversations of the pros and cons and weigh all that. And then find the support of people who are going to support you along that journey that works for you and your family. No one else
Yes.
needs to know what happens outside of your four walls. Just like we were talking
No.
about those parents earlier that say, like, oh, I would never do this, even if my child was in the worst situation. Go inside of their house.
Lies.
I guarantee that they're not even probably telling the truth most of the time. Like,
Oh, yeah. It's all
no
for
one
show.
knows. Yeah. It's like, that's the problem with social media. Like we talked about, like, you have to have it for business and different things,
Yes.
but you do not know people's real lives. No
You need
one
to
knew I
post
was
and
going through
ghost.
this.
I'm telling you, post and
I do that.
ghost.
I do that all the time. It's like I'm like, "It's good enough. I'm gone." But, like, when we were going through this, like, no one knew besides our, like, very close family.
Right.
No one knew,
Wow.
you
And
know?
now
You're s
you've managed to forge this community. You know
Mhm.
of moms who, like, of all over who've been going through
Yeah.
hypospadias, right, on
Yeah.
behalf of their
Yeah.
kids. And really, yeah, really incredible. Tell listeners where they can follow you and also where they can listen to your podcast.
Yeah. So, our podcast is Born for This Stories. It's on all major platforms. So, Spotify, Apple, all the things. You can also follow us on Instagram. You can either follow my personal page or the podcast page. I post more on my personal page right now just because I'm so used to it. But that's at Dr. Johanna Hartley, and or you could follow at Born for the Stories. So we're just trying to really
Awesome.
trailblaze that missed space for medical parents. And I'm actually, if anyone local to St. Pete is listening,
Mhm.
I'm starting a group called Held, which is going to be support for medical mamas, like a safe space.
Incredible. We need that. So, especially if you have a little one with a rare, unusual diagnosis that requires a
Mhm.
lot of medical treatment, this is a wonderful podcast to listen to for inspiration instead of just fear mongering. I
Yeah.
think it's really inspiring and practical. So,
Yeah.
thank you so much for sharing your story today. It's
Yes.
truly inspiring.
Thank you for having me.
Yes.